Everybody, it's Dr. Brace here. It's Facial Plastics Friday, and today I want to talk a little bit about neck lifts. And I've covered this in the past, but I wanted to go over it again because I just saw a beautiful patient, a great result 6 months in, but it was a result that required a revision. And so when you look at the structure of the neck, if you have a neckline that kind of comes straight down like I've drawn here, you might wonder why. What happened over aging? Why does it look like that? And so we do have a muscle called the platysma muscle that comes from your collarbones, and it comes up and then into your face. And as you age, it's the muscle that makes these bands in the neck as it comes forward, and that can be affecting the shape of what we call the submentum or the cervical mental angle. So when that comes forward, that contributes. The other thing that happens is there are salivary glands that live underneath your jaw, the submandibular glands. And as we age, they can get droopier and they can fill this space and create more of a blunt angle on the side of the neck. And that's what we trim and reduce when we talk about doing a submentoplasty. The other thing is that underneath this muscle, there's fat, the deep fat pad. And this is fat that will not get better with liposuction, fat that will not get better with Tibella, will not get better with CoolSculpting. And so when we do a submentoplasty or a neck lift, what I'm doing is coming from under the chin right here and then removing some of this fat, trimming some of this gland away, and then sewing the platysma muscle together. When we do that, if you have a younger neck, the elasticity of your skin will redrape and you will get this beautiful neckline. If you have an older neck or a neck where the skin has lost some of its elasticity, then we have to lift things up backwards in order to pull that muscle and that gland back, which will give you the sharp neckline. So I want to show a picture here of a patient that didn't like her neck. We had planned to do a submentoplasty with a face and neck lift and an upper blepharoplasty. We also did some fat grafting under her eyelids. And I wasn't quite happy. She wasn't quite happy with the way things turned out. And that's something that we talk about with every patient, that sometimes you need to go back and tweak something. And so I went back into her neck, and when we did, what I found was that the gland on her left side actually was a little bit more prominent than the right side, which was accounting for some of the fullness. And she actually had some extra fatty tissue and some lymph nodes that were in that area. So I trimmed those away and we sewed things back up again, and we were able to get a beautiful result, which I'll show here. And so these results happen or are able to be achievable because I've contoured and I've removed those deeper structures of the neck, which allows the skin to redrape in that space that we've created. So it's funny that you don't have to cut any skin away on a lot of people to get that neckline, because there's actually more area to cover than there was beforehand. When you think about removing that deeper layer, those deeper structures, you create more of a surface area for skin to redrape over. And so that's what happens in a deep neck lift. It's sculpting of normal structures. Sometimes it needs to be touched up like anything in a surgery, because on the table it can look perfect, but then as things heal, things can drop, things can shift, and sometimes have to go back. Send us your questions about neck lifts. I'd love to answer them. Everybody have a great Facial Plastics Friday.